Scapular depression and adduction MMT. The patient should be prone on the table with the test arm overhead about 145 degrees of shoulder elevation and abduction. The therapist is standing to the side of the patient while stabilizing the contralateral scapula during passive motion. To properly test MMT, the therapist passively takes the patient through the motion they want the patient to do, stating, "This is the motion I want you to do." Then the therapist palpates the primary muscle being activated. For scapular depression and adduction, this is the lower trapezius. While the therapist palpates, the patient actively performs the motion. If the patient is able to complete full active range of motion, resistance should be applied. Have the patient hold their arm in a roughly 145 degrees of elevation and abduction. The therapist stabilizes the scapula while applying a force to the patient's arm directly perpendicular and just proximal to the wrist joint. Instruct the patient to hold strong, don't let me move you. Apply force gradually towards the floor for a total of 3 to 5 seconds. If there's no break, this is considered a grade 5. If the patient breaks slightly, then is able to hold, this is considered a grade 4. If the patient can complete full active range of motion, yet breaks immediately, and is unable to hold against any resistance, this is a grade 3. If the patient is unable to complete full active range of motion or can't lift their arm, testing should continue in a gravity minimized position. The gravity minimized position is the same, but now the therapist is supporting the weight of the patient's arm while the patient completes the motion. The therapist palpates the muscle belly throughout the available motion. If the patient is able to get through both passive and active motion equally, then this is a grade 2. If there is just a muscle twitch, then this is a grade 1, and if there's nothing, this is a grade 0.